Welcome to the office. We made some changes.
In the diet, yes.
Yes.
And I did not have dairy, which was very hard.
Yeah.
But I was able to
So no dairy, no gluten.
And no meat.
No meat.
Yep.
This week. 7 days it's been.
Mm-hmm.
Okay. How is the inflammation in the body? How is the pain? How is what's going on?
To be honest, there's no pain. I don't feel like I'm trying to cope up with the pain every time I'm getting out of the bed. So it's pretty nice. Like I can wake up and not be in pain. It feels amazing. Okay. The only thing is I still have
The only thing.
but as you said,
what do you feel?
You're not supposed to sleep on the left for a bit.
You're feeling the shoulder?
Yes.
Left shoulder? Mm-hmm. How about the right?
Right's just fine.
Everything else?
Everything else is fine.
Okay, so what we'll do today, we'll continue. We'll check, see where you're at. Mm-hmm. We'll check the tissues, and then I'll do a quick scan with the bone comb to see if we actually need to do anything.
Okay.
So we have some good skin changes that are clearing up. There's less swelling. And sacrum swelling is less too. Good. Let's walk. Are you happy with what's happened so far? It's only been a few visits. Mm-hmm. Now remember, you came in, ankylosing spondylitis is the diagnosis, right? Now, I'm not treating that as such. That's not what we're doing here. Mm-hmm. What are we doing here? We're helping your body get back into balance with wherever it's at right now, okay? And getting this inflammation out of your body. And as we said, is helping you manage this, whatever it is. And we'll probably do some more tests on that down the road, okay? Mm-hmm. Just to make sure.
I also wanted to ask what helps you from delaying the process of degeneration.
Degeneration of what? The spine? Yes. Or joints in general?
Well, in general, like spine and joints.
That's a big question, yo. And I need to do a whole class on this. It's a whole class. And I have a video. I need to redo it though. But for those of you guys that want to know, it's called Dr. Rahim Chiropractic 101. And it's a video on my channel. And I go and I talk about the spinal defense mechanisms. And SDMs. There are 5 major defenses that the body has to protect the nervous system at all costs. And the final defense is calcium in bone or arthritis degeneration. Okay? I need to do a new class on that to explain that. But I do have a video. It's about 45 minutes, okay?
I'll watch it.
And if you want, I'm doing a whole X-ray analysis class, you can bypass that. Have a seat, let's continue. You can bypass me drawing the lines on the x-rays if you want, but there's a lot of fantastic information on that. And the only reason people aren't watching it is because there's no cracks, and it's a little darker video, you know, it's not as bright and exciting. Neck is clear today, yo. We getting 12 points around your T6. 6, 7 points, left sacrum. Sacrum, T6. Open and close your knees, please. Good. Open and close. Watching my fingers. My fingers are on the medial aspects of the PSIS. Left side only. Left knee only. So when she does the left, a little bit of shifting of the tissues. Feels pretty good though. Tiny bit. Right side only. So there's more shifting. When she does the right, the whole left wants to go with it. Do you feel that? Mm-hmm. Okay, scoot back for me, please. So we're more on the left SI joint. Back slowly towards me. Panche. 5. Good? Mm-hmm. 4. 5.
5.
Yeah. Now let's go down. S1. S2. Yes?
Mm-hmm. Go S.
S3. You feel that one more? S3, bottom left side. Yes?
Yes.
Okay. And as we're running our fingers down the spine, The tissue resiliency is a lot nicer on you now. It's not boggy like before. It's pretty cool, yo. 6, 5. 5 more tender, 6 more tender. 5. 1, 2, 3, 4, 5, 7. 1, 2, 3, 4, 5, 6. Still 5. 6.
What's a PRS?
PRS means posterior right superior. These are static listings in the Gonstead work. And when I say a static listing, it's telling us the position of this bump in relation to the one below. It's back, it's right, and it's up. So what do we have to do? Very logical. If it's back, right, and up, we're bringing it forward, down, and left. Back to the center of the body. Just like that. Home run. I'm going to do a tiny bit more of it, double thenar. I want to get a little more through the joint. There. A little more still. There you go. You okay?
Yes.
Hi.
I'm feeling my shoulder.
Feel what? Better?
Yes.
Move your shoulder. Move the left.
Yeah. Just like on the day one.
Keep walking. Okay, we're ready for the sacrum now? Okay, rotated sacrum. Are you okay?
Yes.
Sure.
Mm-hmm.
Now, for the cobra, if I'm doing just a pull move here on the sacrum, it's just, we're doing wrist flexion. So it's this, okay? It's this. It's not this. It's not like that. It's get through the joint this way. Flex through it, okay? If I'm doing the cobra, then I'm going to be 2 fingers here, and my thumb is just medial to the PSIS, like this. And it's still a flexion of the wrist. Home run. Stand up, please. Walk it off. Feels different on the pelvis now, right? On the sacrum. Keep going. Tick. Now I'm going to do something a little different. I'm going to actually get more of your sacrum.
Okay.
There's still a tiny bit. We're going to do it now. Involve side down, push, pull. Left side down, please. So the finger pull or the finger push of the sacrum is using the fingertips. Now we're going involve side down, so the contact is actually still at the bottom. Tuck forward. And I want to show this if you don't mind. It's kind of cool. Look straight ahead that way. Good. So, for the rotated sacrum involved side down, we're still going to be here on the sacral ala, but obviously I can't get my fingers here and push forward. So I'm doing it's called a knife edge contact there. And I'm on the bottom part of the sacrum. I'm going to be pushing the bottom part forward. Okay? And then you can tell us what's different about that. Take. Ready? So bottom part of the sacrum. Ye dekho. There's the rest. Little different, right?
Yeah.
Well,
it actually feels at the lumbar.
So that one you felt a little higher.
Yes.
Okay.
Feels like my posture is like getting that curve.
Correct. Meaning when you felt it in the sacrum, but you also felt it release in the lumbar?
Yes.
Okay. Or did you feel it twist in the lumbar?
Not the twist. But
A release.
Yes.
Tika. Now check out her posture, the way she's sitting here. All clear there. Relax the shoulders, please. Good. T6 is clear. Sacrum is clear.
Yep.
S1, good. S2, 3. Take. Let's check the shoulder now, please. And before that, let's do ears. Us. AI shoulder, over, around. It's not a lot. Drop it down. There. Cool. All right, so what we're doing here is we need to work the swelling out of the capsule, okay? Lateral capsule, lateral meniscus. Are you okay? I know. If it's too much, you tell me, I stop, okay? Yes? Okay. Hi. 5, 4, 3, 2, 1. 1, 2, 3, 4, punch. Hold on to the table, please. You got it? PEX tibia. There we go. Superimpose. Good. There you go. Acha? Good. Stand and walk, please. Tell us what's different, please, if anything.
The knee feels better. Like I always had problem with my the whole left body. When it comes to my walking style, I kind of have this tilt, and then.
So that tilt you had coming in.
Yes.
Is it still there?
No.
You don't, because I don't see it. When we're doing guasha, I call it the bone comb. We're scanning the body. We're using a hard surface on the soft surface. The reason I call this the bone comb, it was taught to me by a massage therapist when I was an intern in Phoenix many, many years ago. And the original guasha tool she brought me was made of bone. And so I was like, oh, it's the bone comb. Now, as we're scanning, we're feeling for smooth glide. Wherever it's gritty, we're going to run through it a few times. And you can hear it. 1, 2, 3, 4, 5. So, same thing. Now I'm scanning the fibula or the peronei muscle. And it's right at the origin behind.
What does it really do?
What?
What does it do?
This? I'm breaking up scar tissue. So you know the machine that I have, that I use? The buff and polish?
Yeah.
I only got that 2 years ago. I used to do this with everybody. And it does bruise a little, yes. It does go deeper. The machine works really well. It takes more sessions. Now watch. Deco. You okay, right? You can handle it. It's getting red now. You better tell your peeps at home it's going to be a little bruised, okay? 5, 4, 3, 2, 1. Okay? You got some work here, lady. 5, 4, 3, 2, 1. Bas, ho gaya. Let's do this side now. Now, when you're doing guasha, again, you can use some sort of hard surface, like I said. The key is please try to work everything towards the heart because you're breaking up a lot of the scar tissue, swelling. A lot of toxins get released here. Make sure you drink an extra liter of water today, please. Okay? 5, 4. You're okay, though. You can handle it.
I will.
5, 4, 3, 2, 1. Yo, you getting exfoliation today, too, yo. What's up? Listen to that scar tissue. That scar tissue, yo. 5, 4, 3, 2. That's scar tissue. Deco either. Not so bad on this side, see? 5, 4, 3, 2, 1. Walk it out. Hi.
You okay?
Bolo? Bolo? It feels great after. Please, please, please drink water. Please.
Yes.
You're getting your curve back now, yo. This is good stuff. Squeeze. Scaphoid, posterior ulna. Mm-hmm. Scaphoid. Squeeze. Relax there. Lunate, posterior radial head. There you go. Scaphoid. Go like that 5 times, please. Questions? We're doing good? Now, 1 week. It's only been 1 week of gluten-free, dairy-free, vegan.
Yeah.
And it's not forever.
Yeah.
It's just to help clean up. You know, and people also ask me, how do you eat? Yeah, I've done vegan 4 years. I've done keto. I've done all these. I don't really like labels. Okay? It's whatever it is for that person in that point in their life.
Right.
Right now, you clean up. Then the interesting part is you'll add foods later. When you add those foods, you'll know how your body responds or reacts. And you will know yourself what's good or bad for you.
Right.
Right? I'll
Thank
see
you
you.
so much.
You're welcome. Okay, so it's been about 3 weeks.
Yes.
What happened?
My back acne is completely cleared. I don't see like not even one pimple or anything or breakout.
Okay, but that's not what you came for.
No.
What'd you come for?
Come for my pain.
Body pain, right?
Yes.
And they said you may have or you do have ankylosing, some inflammatory stuff, right? That's what they were saying. We changed the diet. We've been adjusting. In terms of the diet, I asked you to go vegan for 1 month. It's been well over a month, but you're not just doing vegan, right? You have some meat. You have meat in your diet?
Yeah.
Okay, and dairy?
Not like dairy. I switched milk with almond milk, and then I like to switch it with the vegan stuff.
Okay.
But I still eat like fish.
Okay, cool.
Yeah.
Now, let me ask you this. If you compare what you're eating overall
Oh.
now versus last year,
Huge
what's the
difference.
biggest difference in the way you're eating? Is it the quality of the food? Is it the food? Is it the portion? Is it all of it?
It's all of it. Like it's the portions definitely, and especially that I'm not eating dairy like I used to anymore.
Okay.
And that definitely helped with my acne and inflammation too.
Okay.
I don't have like pain like the way I used to before.
Okay. Well, we're going to take a look and see kind of what it looks like also. So the pain inflammation is less.
I've been actually like pretty well for 3 weeks. I thought like things might go back to, you know, the pain and stuff, but it did not actually.
Are you feeling anything today?
No.
So we're here for what? A checkup? A tune-up?
Yeah.
Okay. So it's more of a wellness check. Now, it's kind of cool, right? We haven't done so much adjusting.
Yeah.
We did some lifestyle modifications, and you're getting the result you were looking for. That's kind of cool. You can look at her skin. It's a lot smoother. You can turn this way a little bit. You see that? So it has cleared up quite a bit. This is still a little bit higher. The muscle is a little more pronounced here on this side. The ear is high on this side. You sleeping okay? Yeah? You didn't fall asleep on the couch last night?
I've been using pillows, and probably that's one of the reasons.
Okay.
I never used pillows.
I would say don't, because it
Yeah.
looks like your left atlas or left side is a little bit higher than normal. Very good. So walks, hikes, activities, everything is good. Any limitations, anything bothering you in your daily activities?
Not at all.
All good.
Yep.
Okay. Walk on your toes, please. Yeah. I'm still getting the shift of the right pelvis. Still getting that little wiggle on that right side. Mid-back is clear, yo. Nice. You want the good news, madam?
Yes.
I got a tiny little bit up top here. This is all clear.
Oh, wow.
We're on the pelvis and we're doing up top today. Open and close. Right side only. Left side only. Right side. Okay, the wiggle is actually coming from the sacrum there today, okay? You feel that?
Mm-hmm.
I'm getting it. Pelvis is fine on examination. So we're going to do sacrum. We're going to do C1. So we're right on the C1, anterior aspect. She's very flexible now, so I got to come down. I got to bring the elbow down with it. Home run. Gotcha. Butter, baby. Walk it off, please. Makhan. Yeah, makhan here. You know makhan, right? Mm-hmm. Okay. Walk, please. Ah, that was cool. That already leveled out your neck. Sacrum. Nice and easy there. You good? Mm-hmm. Straight through. Good?
Mm-hmm.
Home run. Gotcha. Bolo? Good?
Yep.
Awesome. It's getting better each day. Walk on your toes, please. Walk on your heels, please. Okay, back over here, have a seat. L5, S1, S2, right sacrum, left sacrum. Good? Feet together, open and close the knees, open and close. Right side only, please. Take. Different, yeah? Left side only. No wiggle. Awesome. Ears. And now your favorite part of it all. The TMJ. Sit back for me, please. Ready, madam?
Mm-hmm.
What? Uh-huh. Tayar?
Yeah.
Mama tayari. Ready? Good. Open. So we're going to do the right jaw. Open all the way. Open. Slowly close. Bas. 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 Good. Open all the way. Close. Open. Nice. Open all the way. Close. Ho gaya. Ho gaya. Done. Gotcha. Okay. Anything you want to share with everybody from being here for, what, 6 visits?
It was not just about the adjustments. It's also about how you maintain it from your end.
Meaning what you have to do.
Yeah, the diet part, the maintaining part, like how
The
you take
walking,
care of it. Yes.
the attitude.
Mhm.
Good. So it's not just you come here, you get an
Yeah.
adjustment, and
You hope everything
I
is
start the
fixed.
process.
Yes.
But the process is on?
Us.
Yes. You know, there's a saying, you can never get people to stop thinking. The
Yeah.
goal is to get them to start.
Mm-hmm.
Okay? It's important. You've come a long way in a short period of time. We're going to do the ankle AS talus. AS talus. Now I'll do a pull on the talus. AS talus, medial tilt. AS talus. That's it. Calcaneus, top side. Navicular, bottom. Other side, please. Calcaneus, posterior lateral. Inferior navicular. Awesome. Hi, madam.
Hi.
Welcome back.
Yes.
Happy New Year,
Thank you. Same to you.
2021. How's the body been?
But it's been good. Just a little bit of pain in my shoulder, but so far it's been great because I've also started training. I was thinking that once I started training, everything's gonna fall back into pain, and I'm gonna have horrible.
When you say training, what does that mean?
Going to the gym,
Heavy
lifting
training?
weights and stuff like that. Yes.
Heavy training?
Yes.
Okay, like squats, deadlifts,
Yes.
lunges.
But I didn't start off the training with like heavy lifting. I
Okay.
slowly progressed into it.
Okay.
I also have like a personal trainer who's helping me do that. I haven't had any like major, setbacks or something like that. I came from my pain.
You were having whole body pain, right?
Yes.
You were having whole body
Whole
pain.
body
So it
pain.
wasn't just my low back hurts, my this hurts, my that. It was kind of general.
Mm-hmm.
And we discovered a few things.
Yes.
Right?
Mm-hmm.
We were working on you a few visits.
Yeah.
We changed the nutrition, or
Mm-hmm.
I don't like the word diet really,
Yeah.
but we changed your eating habits. And we
Mm-hmm.
talked about getting rid of dairy and gluten and going maybe pseudo-vegan for a while, right?
Yes.
And through that process, skin cleared up,
Mhm.
you feel better, there's more energy, I'm assuming.
Definitely.
Yes, and it's been several
My
months.
face cleared up too. Like not only my back, but just my face
And
too.
that's not using any other products
No.
or facials
Nothing
or
at all.
anything. So that's pretty cool. So it's been a few months,
Mhm.
right? We changed my
2
schedule.
months, yes.
It's been 2 months, yeah? And in 2 months, has anything new showed up?
Nothing new, just the same shoulder pain, but I've
Left
been
shoulder?
actually yes.
Left shoulder.
Yes.
Okay.
It's always been this side.
Left side. How's the back? How's the knee? How's the ankle?
My back is actually fine. My knees are fine too. I don't have that shooting pain that goes to my left leg. I didn't have that again.
So that the sciatica has not come
yeah,
back.
it's been pretty nice. Yeah.
Okay, and today you're feeling mainly the shoulder.
Yes.
Okay. Training wise, 3 days a week, 4 days a week?
Actually, it's 6 days a week.
6 days a week, okay.
I mean, it's like 5 days of lifting and 1 day of cardio. So.
Okay.
Yeah.
All right, so you're pretty serious about it.
Yes.
All right. So what we'll do today,
Mhm.
we'll watch you walk just to kind of recap.
Okay.
We'll examine, figure out what we're going to adjust.
Yes.
And we're going to do a little bit of guasha because
Okay.
you've been training. So we want to
Yes.
make sure there's no excess or extra scar tissue that's developed. Because remember, in this guasha work, right? What's the purpose of this the bone combing or the guasha? It's to break up scar tissue more in the fascia.
Okay.
And what is fascia? Fascia is that white film that compartmentalizes the muscle. And I just want to go over to this chart real quick. So when we're talking about fascia, and Vandana, I'd like you to see this as well. So you can see the shapes of all these muscles, right? These are the
Yes.
hamstrings, the calves. And what gives it its shape is that white sheath that goes around it. That's called the fascia. It's like, when you have a steak, and that white
Yeah.
white film that kind of holds it together.
Right.
Now, muscle will only expand and contract according to the fascia. So if we have scar tissue in fascia, we have constriction. And so you don't get optimal development of that muscle. So it becomes very important. It's different from tenderizing the meat, like those machines
Right.
that do that. That's something a little different. So guasha is good for the fascia. Also, the machine that we use, any vibration therapy, is going to be very good for that fascia as well.
And
Okay?
is there anything that we could do at the house to, keep maintaining that,
Yeah, I'll give you a guasha cone to take with you. And
Okay.
you just scan your body every 5 days.
Okay.
And wherever you're feeling the constriction,
Mhm.
wherever you feel it, that's what you want to break up.
Okay.
And you're always working towards the heart.
Okay.
Remember,
Upward.
most important.
Mhm.
If you're down here, down. If your arms are up like this and you're going down like that, then you go down like this. And we'll demonstrate a little bit of it.
Okay.
Okay?
Yeah.
But look, we have more symmetry here. So the scapula a little more balanced. We have a little more symmetry through the lats and here. I do see a little bit more puffiness on this right side here in terms of the swelling. There's swelling here. Okay? This is more symmetrical, but it's twisting from this point here. I'm looking at the sacrum, and it's just looking a little bit off to me. Now, go ahead and walk for us several times back and forth, please. Yeah, so something is stuck between L3, turn around. Let's watch here, please. So between here and here, something is definitely stuck in here. Go ahead and walk. The right dimple moves, the left dimple's not moving.
Okay.
Keep going. Yeah, that left dimple. We're still getting a little bit of that side wiggle. And the first thing we're getting is about a 5-pointer. C7, C6, C7, base of the neck. Good news, upper neck is clear today. As we run down, we're getting it around T5, T6. That's our digestion area we talked about. Dude, your back is cleared up a lot. Wow. Open and close the knees. Good. Right side only. That's the shift. So when she does the right, the whole left is shifting. And this is that swelling and that puffiness right here. That's the sacrum. Do the left side. When she does the left, the right is fine. So we have left SI joint, left sacrum. Head down, please. Let's statically palpate. Running our fingers down the spine. And you can see as soon as we get to right about there, that's the swelling edema. 7, 1, 2, 3, 4, 5, 6, 7. Round your back, please. That's 7. That's 6. That's 5. That one or that one?
6.
6 today. 3, 4, 5. T6, left sacrum. C6, C7. More tender at 7, more tender at 6.
6.
6. C6 PLS. So for C6, we're using the distal palmar surface of the index finger. We're going to be on the posterior lateral inferior aspect of the spinous process. We're getting right under that spinous contact. You're going to, with your 2 fingers, you're going to stack the vertebrae, bring it back. You're stacking the vertebrae, the spine, the whole spine on that fingertip. So C6 and everything above is stacked together. Laterally flex to the left. We need to get that lock out. Lock out. Good. She's a little tense there. There it is. Good. That's a great miss. Left ear down, down. There you go. Home run. Rotated sacrum. Now, for the rotated sacrum, there's the medial border of the PSIS. We're going to push the tissue out of the way and get right on that sacrum. Index, chiro, and middle finger. Now, the key with this one, we call it the cobra. It's really a finger. It's a wrist flexion with straight fingers. It's this, and that's why I kind of call that the cobra, because it kind of looks like it. Hi. Gotcha. Home run. Come on up and let's walk it off, please. Now from that, tell me what's different, if anything, on the walk right now.
The left feet feels more stable.
Let's see if the dimples are moving better. Go ahead. Right, Jasha? Mm-hmm. Dimples moving better. All right, we're going to do T6. We said as a PLI. What is a PLI? PLI is a static listing. It means the spinous, the static listing is what's the static position of the vertebrae. It's gone posterior, the spinous has gone left, and it's inferior to the wedge, which is on the right side. 1, 2, 3, 4, 5, 6. So we're going to be on the spinous of T6, and we're coming straight through. There you go. That's a little spicy today. 1, 2, 3, 4, 5, 6. PLI. Good. Madam, you're too tight, madam. Boss. Thodi se baat, okay? A little bit more, please. You're doing too much back workout. Gotcha. Home run, baby. Excellent. Good. Excellent. It's a little spicy, yeah? Yeah. Have a seat, please. Let's continue. All right. Let's ReScope. Starting at the base. C6 is clear. Good. Sacrum is clear. Feet together, please. Open and close. Knees to get feet together. Open and close the knees. Good. Right side only. There you go. Left side only. Awesome. Awesome. Let's go on your back, please. Feet together. Okay. Bring your ankles back. Bring your toes back as far as you can. So here's one good test. You can see the left side is fine. The right side is what's stuck. So when we have an AS talus, anterior superior talus, she has an AS medial tilt. It limits dorsiflexion doing this. So that's a good test. And when I feel here, a little tender there.
Yeah.
So this side is fine. We're going to focus on the right one today. Okay? Cool. क्या हुआ मैडम? दुखा हुआ? भूल गया? You forgot, madam. इधर आओ. So I'm working the swelling, okay? I'm working the scar tissue. This is AS talus. Madam, क्या हुआ, madam? She's gonna get, you gotta get her facial expressions too. क्या हुआ, madam? 5, 4, 3, 2, और एक. Bus, madam, bus. You can handle it though, yes, madam? Please. 5, 4, 3, 2, bus. I'm on the dome of the talus, medial aspect. I'm using tissue just so we don't slip off. Idhar आओ. Bas. Poquito. That's it. Now, let's look at the ankles. Bring them back and forth. Back and forth. Good. All the way back. Dekho. More even. Okay? Flip over onto your stomach now. So we're starting at the bottom here. And what we're doing with the Guasha comb, guys, is we're scanning for those knots, or as they say in India, gatta hai. Huh? Gatta. Pakistan mein kya bolta hai? Gatta? Khabar nahi. Vandana, you speak Urdu, right?
Hindi.
Hindi. But you speak Urdu also.
Yeah, kind of.
So gatta kya hai?
Gadda.
Gadda. Not gunda.
No.
So we're working out the knots, okay? There's a gritty feel. When you run this hard surface over a soft surface, it should have a nice smooth glide. When we start to get, you can feel there's a lot of grit in here. 5, 4, 3, 2. Now I'm going on the back side of the peronei. Peronei muscle from behind. Back of the knee, that's the origin. Okay, so we started at the Achilles, we went up into the calves. You feel it, right, Vandana?
Oh, yes.
Yeah. Then we're getting into the hamstrings. Now she's doing some heavy, the density, it's a lot more dense today than our last visit. So you are getting your workouts in. Get into the hamstrings, and I'm not going to be doing the IT band as I said. We're going to go into the G medius insert. If you can handle it, let me know. If it's too much, I'll stop, okay? Please. More lotion?
Yes.
It is going to bruise a little bit, okay?
Okay.
So we're getting into G medius and piriformis. Insert 5. 5, 4, 3, 2, 1. Good. Awesome. 5, 4, 3, 2, 1. Good. Abhi, other side, madam. And you can go back to the video also, Vandana. You can be doing this at home. You guys can do it on each other too, okay? All right, now let's do the left side. Starting at the Achilles, I'm using the inside, working towards the heart. This side is a lot better, Vandana.
Yeah.
This side is fine here. Good. Okay, now we're going to get in to the hamstring. 5, 4, 3, 2, breathe in, please. Thank you. 1. Questions? I'm just trying to distract her, that's all. Because it's not that fun. But it does the job. So here, I'm getting into the G medius. G medius. G medius. 5, 4, 3, 2, 1. Yes. There we go. Turn over onto your back, please. And the focus on the thigh is really the quadricep insertion and the VMO here, okay? Because one of the things in your leg workout, you need to make sure your VMO. VMO is this muscle here, vastus medialis obliquus. It's a knee stabilizer, it's not a primary mover, which means whenever you're working VMO, it should be the last thing, or any stabilizer should be worked out last. So you do your leg workout, and the last thing you do for your legs is VMO, which is last 15 degrees of extension. So you can sit and do 15 degrees, or you can squat just the top 15 degrees. You get it? This. So it's this movement.
Oh, okay.
So it's external rotation with extension.
Okay.
That gives you that little bump.
Okay.
You know what I'm talking about?
Yes.
I'm specifically staying away from your IT band, okay?
Okay.
Specifically, because next time you'll tell me, make a note after 2-3 days how your IT bands are feeling.
What's an RD band?
That's the band on the side here.
Okay.
Iliotibial band. A lot of people like to get that worked out and foam rolled. Bend the knee a tiny bit.
Yes.
Bend
Do we do that or no? Right?
No. Check out Athlean X on
Yeah.
foam rolling IT band. Check out his stuff. It's pretty good. 5, 4, 3, 2. Last. There you go. One more, madam. Almost done. So, the other thing you should look into also is balance work. Right? So, rocker board, wobble board.
Mm-hmm.
Incorporate that proprioceptive work into your workouts. And we're going to be doing a few video series down the road.
Okay.
Okay? And we'll go over a lot of this stuff.
Okay.
We'll have it for class.
Okay.
5, 4, 3, 2, 1. Yes. Stand up and let's walk that out, madam. And as you're walking, tell us if anything has changed. What do you feel different from after the guasha in addition to the adjustment?
I don't feel like my body is tight.
So from the guasha, what happened?
I think it's probably like clearing up of, the tightness at certain areas of my muscles.
Okay.
Definitely feel like a lot flexible.
More flexibility.
Yes.
Okay. Squeeze. Squeeze. Dude, you are working out, yeah? Elbow, radial head. Squeeze. Bilateral, radial head. Posterior lateral radial head. Excellent. Squeeze, squeeze. Turn, let's do the ears. Am I checking jaw? Jaw is okay?
I think so.
Let's see. Have a seat, please. We're going to do an AI right TMJ. Open all the way. Open. Slowly close. Gotcha. Bus. Awesome. You are all set, madam. Hi. Questions?
Oh, good.
We're good for today?
Yes.